All right, I'm a coordinator at McMaster University for the Canadian Housing Evidence Collaborative, or CHEC. And we will begin today by giving honor and thanks to the Haudenosaunee and Anishinaabe nations, who are the traditional inhabitants of the lands where McMaster stands. To say that is to acknowledge a debt to those who were here before us and to recognize our responsibility as guests to respect and honor the intimate relationship Indigenous peoples have to this land. Welcome everyone to the CHEC webinar series. CHEC is the knowledge mobilization and capacity building hub of the Canadian Housing Research Network, CHURN, an independent Canada-wide collaboration of academics and community partners funded by the Canada Mortgage and Housing Corporation to support housing research and policy in Canada. Today's webinar is brought to you by the Aging in the Right Place Partnership, one of 5 academic nodes that make up CHURN, which is dedicated to addressing homelessness and housing insecurity among older adults across Canada. Dr. Sarah Canham, Director of Aging in the Right Place, will lead the presentation from now on. Over to you, Sarah.
Thank you, Lindsay, and thank you to the all of the CHEC team for having us and co-hosting this webinar with us today. I also want to thank the folks who have taken time out of their busy schedules to join us for this webinar. I am a faculty member at the University of Utah, but also an adjunct faculty member out of Simon Fraser University, where I serve as the project director for the Aging in the Right Place Partnership Project. If you haven't been to our website or subscribed to our newsletter, we hope you will, and we will provide those contact details for you on the final slide. I'm excited to serve as a moderator for today's webinar, which we've called Policy Pathways for Aging in the Right Place, Strategies to Address Homelessness Among Older Adults in Vancouver, Calgary, and Montreal. This webinar accompanies a report that our team recently published, which we will also provide a link for. And that report outlines in a lot more detail than we can really cover today. So have a look at that full report on anything that is of interest. We'd also like to make a handful of acknowledgements. There's many who made this webinar and this report possible. If you could advance to the next slide. First, this research was conducted in a number of places. So we want to respectfully acknowledge that Simon Fraser University is located on the unceded and traditional territories of the Musqueam, Squamish, and Tsleil-Waututh nations, that Calgary is on traditional territories of the people of the Treaty 7 region in southern Alberta and home to the Métis Nation of Alberta Region 3, and that Montreal is situated on the traditional territory of the Ganya-Geha. So second, we also want to thank our lived expert advisors and our researchers and staff who provided critical feedback and design support for this project. And similar to the CHEC team, our partnership is supported by funding from the Canada Mortgage and Housing Corporation and the Social Sciences and Humanities Research Council, for which we're grateful. And without that funding, this would not be possible. So since 2020, the Aging in the Right Place Partnership has been evaluating promising practices of shelter and housing options for older adults with current or past experiences of homelessness in 3 cities, Vancouver, Calgary, and Montreal. And the goals of the broader project from which this policy report comes from are to build capacity and knowledge, to bridge the gaps between research and practice, as well as to promote policies that that have been proven to support aging in the right place for older people with experiences of homelessness. So for this project, we conducted a literature review and a jurisdictional scan. The literature review, we looked at ways in which different jurisdictions and programs address homelessness among older adults from across the world. We identified numerous themes related to how best to support older adults who have had experiences of homelessness and how we can support those individuals to age in the right place. And we presented the variety of themes that we came up with through this research to our diverse partnership stakeholder groups, including our lived experts and others. Some of you are on this call. Thank you for joining us. But we really, after that, those conversations and that stakeholder consultation, we narrowed in on these 3 key themes that you see here that we thought were the most relevant to increasing affordable, accessible housing options for older adults and to support them to age in the right place. And so here you see housing stability, which includes having long-term residency in one's home and the community of choice. Supportive housing that has integrated services includes housing that offers those individualized and flexible on-site health and social support. And finally, having inclusive housing design is that which supports changing mobility and accessibility needs of individuals as they age. So finally, based on our key findings, our policy recommendations are primarily for the municipal governments of Vancouver, Calgary, and Montreal. Each of these we recognize as representing unique demographic and socioeconomic contexts. We're going to begin with Vancouver, and though Dominique prepared the Vancouver section for us, is unable to be here, so Isabel will be presenting that for Dominique. We'll then move to Calgary and then to Montreal. And just a reminder that we will be monitoring the Q&A and the chat. So if you have questions throughout the presentation, please put those on and we will get to them at the end of the presentations. So I will pass it over to Isabel. Thank you all for joining us.
Thank you, Sarah, and thank you all for joining us. Really excited to talk about some of these recommendations and things we discovered through this project. We can go to the next slide. First, I just want to provide some context about Vancouver's housing market, how older adults are affected, and what the city has done so far. When we take a glimpse into Vancouver's housing market, we know that it is the least affordable in Canada and the third most unaffordable in the world. So not so great. Single-family detached home prices have increased between 95% and 100% since 2010, while rent prices have increased by over 45% between 2011 and 2021. In addition, vacancy rates in the city are near 1%, which is significantly lower than the 3 to 4% that most experts would agree indicates a healthy and balanced housing market. Furthermore, about 77,000 Vancouver households fall below CMHC's housing standards. Next, when we look at older adults and housing in Vancouver, we can see that older adults are Vancouver's fastest growing demographic, that 30% of older renters are experiencing unmet housing needs, and affordability is their top housing challenge. We also know that low-income older renters are the most vulnerable and the most likely to describe their housing situation as unstable. And recent data also shows that 21% of the people experiencing homelessness in Vancouver are aged 55 plus. Finally, when we look at what the City of Vancouver has completed so far in this direction, we have a seniors housing strategy that came out in 2024 with the overarching goal of ensuring older adults have the housing and support needed to enable aging and appropriate and affordable housing in their community. So this strategy really focuses on prioritizing affordable housing options, such as social housing, supportive housing, co-op housing for older adults. At the same time, however, the number of older adults applying for these subsidized housing options outpaces the construction of these units. Next slide, please. Thanks. Which is why we came up with some policy directions for Vancouver. So although responsibility for improving housing for older adults in BC does not lie only with one single governmental body, the City of Vancouver does hold most of the authority within the city limits. So the following recommendations are intended to guide the improvement of housing for older adults with experiences of homelessness to age in the right place. And these are, number one, to support modular, temporary, and permanent housing for older adults across Vancouver. Number two, to advocate to the federal and provincial governments to increase financial assistance and supplements to older adults. Number three, to create an online homelessness prevention information hub geared towards older adults. And number four, to establish a free older adult specific transportation pilot project. When we look a little bit more deeply at the first one, which is supporting modular housing initiatives, this refers to prefabricated housing, which is built off-site in a factory and then transported and assembled on-site. So in 2017, the City of Vancouver rolled out a modular housing initiative in order to quickly build temporary housing for people experiencing homelessness. This allowed for quick construction and provided immediate relief to people who didn't have a home. In 2023, however, the city decided to back away from building temporary modular housing. In this time, about 200 studio apartments have already closed, with another 600 are set to close by 2028. Modular housing has been historically used as a temporary solution, but it could also be utilized as a permanent solution, since there is just a gap in available rental housing for low to middle income older adults. In addition, the federal government also has a loan program currently for developers that use modular housing techniques, which is an opportunity that could be advantageous for the Vancouver housing market. As a result, some of the more specific recommendations or steps we would love to see taken in this regard would be to explore opportunities within the City of Vancouver's bylaws to expedite the approval of modular builds. Second, to reserve at least 21% of modular housing units for older adults, matching the percentage of older adults who are experiencing homelessness. Number 3, to explore options for an older adults only modular housing project that offers on-site services and accommodation and design features that would enable older adults to age in the right place. And finally, to encourage the City of Vancouver representation on the BC Mayor's Task Force, which would express support and commit to ensuring modular builds have a space in current and future city plans. And in this particular instance, if you're looking for something with a little bit more information or where this has been completed elsewhere, in our report, we discuss a little further a case study on modular housing, which is the Diavolitsis residence in Copenhagen, Denmark, which was commissioned in 2013 by a nonprofit affordable housing association, constructed using modular housing techniques with stacked prefabricated modules. And then the bonus of this is that the use of prefabricated building techniques and materials and wood and concrete for both inside and outside allowed the construction cost to be kept low. Next slide, please. The next recommendation was to increase financial assistance and other supplements. In 2022, the median annual income for those aged 65 plus in BC was around $35,000, which is the lowest it has been since 2018. Most older adults in BC receive pension income from Old Age Security and the Canada Pension Plan, while only 28% of them receive the Guaranteed Income Supplement top-up for low-income older adults. Altogether, those would provide an average annual income of $22,649. The province of BC also provides SAFER through BC Housing, which is a rent subsidy for Canadians and permanent residents aged 60 plus who have a gross income of less than $40,000 a year. Although the rent subsidy for that program the ceiling is $1,150, the current average rent in Vancouver is higher than that, is about $1,900 a month. Additionally, for low-income adults who receive OIS or GIS, but not CPP, the province offers a senior supplement top-up, which is maxed out at around $100 for single older adults. In 2022, the BC Seniors Advocate released a report in which they recommended that this supplement be adjusted for inflation and for the SAFER subsidy to also reflect the current rental market. As discussed previously, the current amounts of money received wouldn't be able to cover the average rent in Vancouver. So some steps we would love to see taken would be to have the city advocate to the federal and provincial governments to increase direct financial assistance and other supplements to older adults, to ensure that the information on federal and provincial income sources, top-ups, and subsidies clearly detailed on the City of Vancouver's website, which is an easy intermediary for adults looking for income and housing support. And then to support and promote a variety of avenues for financial aid and cash transfer programs for low-income older adults, including those that are not tied to specific federal or provincial programs. Third, the next recommendation category was to create an online prevention hub for homelessness prevention hub for older adults. Currently, the City of Vancouver has a homelessness services and resources portal that doesn't really easily provide information for older adults who are at risk of or currently experiencing homelessness. And one thing to note here is that smartphone and computer use is actually quite prevalent among older adults. Nearly 9 in 10 older adults aged 65 plus in BC used the internet in 2022. 87% of Canadians 45 to 64 and 54% of those aged 65 plus all reported having a smartphone in 2020. So findings show that older adults feel confident using technology and feel that that can help them stay safe and independent in their homes for longer. In this way, libraries that can support the development of digital literacy skills for those who need it or provide access to free computers or a smartphone are really integral to accessing this information. So our steps here would be to create a dedicated, easy-to-use, interactive online hub for older adults to get information on housing options, landlord mediation, outreach services, and individualized client support. As some older adults might prefer to speak to someone on the phone, a dedicated phone line would also be helpful and recommended. For example, United Way's 211 line provides this service and could be included as an easy-to-reach helpline. Second would be to develop an awareness campaign to ensure that older adults and their care providers are knowledgeable about how to access and navigate this hub website. That could include signage in places that are frequented by older adults, like the libraries, pharmacies, and informing outreach staff in shelters and seasonal warming centers. And finally, to sustain funding for public libraries, including funding for technological devices and staff to offer digital literacy training. Last but not least, for Vancouver, we have a free older adult-specific transportation pilot project. Limited public transit routes can really limit the mobility of older adults and make clear the need for age-friendly transportation services to allow aging in the right place. The province of BC does offer reduced fare bus passes for certain low-income adults aged 60 plus through the BC Bus Pass program. However, this doesn't actually include the HandyDART, which is TransLink's door-to-door shared ride service for people who are unable to navigate conventional public transit without assistance. As a result, older adults therefore need to obtain multiple types of bus passes, be able to afford different fares, and navigate different types of transit as they try to get from one place to the other, which can deter them from transiting to different places around the city. Given the expense and the unreliability of the current transportation options for older adults in Vancouver, the city should pilot a new older adult-specific system. Offering this free mode of transportation would ensure that all older adults are able to connect to essential appointments, visit with family and friends, participate in their community, and be supported to age in the right place. So we would suggest the City of Vancouver would pilot a free public shuttle service within Vancouver city limits for older adults to access key locations like grocery stores or community centers. And second, to advocate to TransLink to consolidate the different transportation programs for older adults into one pass, which would make it easier for older adults to navigate the current transportation network. And it'll be me again speaking, but now we're moving on to the city of Calgary. Some context on the city of Calgary, located in the province of Alberta. I'll speak about the population of older adults in Calgary, the action taken thus far by the city and the province, and some recent updates on progress. In 2018, the Calgary point-in-time count showed that 5.5% of the homeless population was aged 65 plus, and another 13% was aged 44 to 65, demonstrating the high proportion of older adults who are experiencing homelessness in Calgary. In addition, individuals aged 45 plus are the fastest growing segment of the population at the Calgary Drop-In Centre, which is a local emergency shelter. And this is an increase of about 20% from 20% of the shelter's population to 60% of the shelter's population between 2001 and 2016. If we look at what the city of Calgary and the province of Alberta have done so far, they both have released strategies on housing and homelessness. So in 2023, the city of Calgary released a strategy titled Home is Here, the City of Calgary's Housing Strategy for 2024 to 2030. And this outlines ongoing circumstances that Calgary faces, such as increased immigration to the city in tandem with an already strained housing supply, and outlines objectives for the future of the city, including building more housing and diversifying housing choice to meet the needs of equity-deserving populations. Alberta, the province, also has a housing plan in effect, the 2021 plan titled Stronger Foundations, Alberta's 10-year strategy to improve and expand affordable housing, which calls for the government of Alberta to transform the housing system in order to provide more flexible, fair, and inclusive housing options. This aims to support Albertans most in need, improve access to housing options, and enhance the sustainability and efficiency of the housing sector while also enabling growth and investment. However, just want to note here, in 2024, there was a progress update released by the City of Calgary after their 2023 strategy. Between that, the 2023 release and by the time they released this progress update, average monthly rent for a 2-bedroom unit in Calgary had increased 12% from $2,367 to $2,653. In addition, while the progress update highlights that 80% of the housing strategy actions would be initiated by the end of 2024, not enough yet has been done to ensure that there is diverse housing choice to meet the needs of people like older adults experiencing homelessness. Some additional context here for you. In 2025 in Calgary, the annual median income of all individuals aged 15 plus was approximately $48,000, but adults aged 65 plus, their annual median income was only $36,400. For an older adult with that income, rent of just over $1,000 per month would be the maximum for an affordable rent. However, the market rent for an apartment in Calgary is more than double this amount, averaging about $2,200 in September 2024. To support older adults who are experiencing homelessness, it is recommended that the City of Calgary look to promising practices and case studies found in other jurisdictions. And so the following recommendations offer several directions that Calgary can take. One being to expand and enhance supportive housing with integrated services for older adults. The second one being to improve access to housing services and information through one window. Number 3 being to create an older adult homelessness strategy for the City of Calgary. And finally, to advocate to the province of Alberta to reinstate a seniors advocate. The first one here is expanding supportive housing with integrated services. The average annual healthcare costs identified in Canada in 2021 were about $12,000 for individuals experiencing homelessness, compared to around $1,900 for low-income housed individuals and $1,700 for housed individuals. Because of the substantial healthcare costs associated with homelessness, programs that quickly resolve or prevent homelessness for individuals of all ages are likely better to address individuals' healthcare needs and more efficiently use public resources. Given that adults aged 50 plus with experiences of homelessness are vulnerable to health conditions, including functional and cognitive impairment 20 years earlier than their housed counterparts, supportive housing with integrated services can offer significant benefits to one's health and housing stability while being more economical for provincial and municipal governments than the costs of emergency healthcare services. Housing with integrated services is a powerful support to older adults with experiences of homelessness, also partially due to the continuity of care aspect. Continuity of care is in which one service provider is coordinating the health care for an older adult with complex needs, and that would be more effective than requiring older adults to seek care from multiple distinct providers. So some pathways for Calgary here would be to rezone land to support the development of supportive housing with integrated services for older adults, and to partner with local nonprofit organizations to develop and operate supportive housing with integrated services. There's already an example of this happening in Calgary, and one of those would be, there are several actually, but one that I wanted to highlight is Peter Coyle Place in Calgary, Alberta. And there are also other programs around the world that do this as well, one being the Medically Vulnerable People Program in Sandy, Utah. And you can read more about both of these case studies in our report. The next main recommendation would be to improve access to information through One Window. One Window is an initiative in progress to facilitate a central intake process for people seeking affordable housing. The concept has been developed in detail and has estimated costs, but to implement this action, the city would need to re-engage with the affordable housing sector. Notably, the City of Calgary has referred to the One Window project since 2023 as a reboot and update. Information on the original iteration of this project has proven difficult to find, but service providers in Alberta's affordable housing sector indicated that the original One Window was discontinued in 2018, leaving organizations to streamline processes themselves. One organization that stepped in when there was no One Window program was the Calgary Homeless Foundation, which operates the Coordinated Access and Assessment Program, or CAA. The purpose of the CAA program is to shift the challenge of finding the right services away from the person seeking help and onto the agencies. The CAA team is operated by the Distress Center and based at Source, which is a resource hub in downtown Calgary with caseworkers called housing strategists. There are more than 80 trained housing strategists across 21 agencies who connect individuals and families to information, resources, and housing over a wide geographic area. Despite these coordination efforts, systems navigation in Calgary, especially of those programs and services provided by the City of Calgary, might actually be better centralized by the municipality itself. In addition, as housing needs are closely related to and sometimes dependent on other needs, thinking of medical needs, mental health needs, social connection needs, it could also be beneficial to have a broader reach of systems navigation to assist older adults in finding supports. And housing providers and programs like CAA may have limited capacity and funding to provide such expanded navigation. Some steps here would be for the City of Calgary to increase collaboration between themselves and housing service providers to successfully reboot One Window and allow easier navigation for older adults seeking housing. And second, to increase the number of service providers and nonprofit organizations partnering with the One Window initiative to have more information on mental, physical, and social resources available to support older adults experiencing homelessness. The next recommendation is to create an older adult homelessness specific strategy. As older adults are a rapidly expanding demographic in Calgary, policymakers and service providers must have strategies in place to support the unique needs and vulnerabilities of older adults with experiences of homelessness. Despite the aging of Calgary's homeless population, there are limited shelter and housing options to support their unique health and social needs. Older adults experiencing homelessness may also be more likely to be invisible or hidden homeless population. For instance, they don't present in traditional point-in-time counts or in traditional homeless serving agencies. So in this way, a strategic plan that focuses specifically on older adults experiencing homelessness can provide more accurate and varied data on the factors that are affecting older Calgarians' abilities to access housing and supports, reasonable income thresholds for older adults to afford permanent housing, the need for housing with embedded substance use programs, space for pets or common rooms, preferred neighborhoods to age in, and etc. And all of these are examples of things that strategy could look into, which would provide a little bit more direction for the city's future. So some steps here for Calgary. Although they already have a homelessness plan, would be number one, to develop a strategic plan to comprehensively research and better understand the housing and support needs of older adults experiencing homelessness in Calgary, which should include thorough engagement with older adults with experiences of homelessness to understand their unique circumstances and evaluation of progress towards achieving the plan's goals. And second, another important aspect here would be to adopt revised definitions of affordable and deeply affordable housing to reflect the current market trends and allow the city to set realistic priorities for developers and housing providers. Last but certainly not least, a recommendation would be to reinstate Alberta's Seniors Advocate. In 2019, the United Conservative Party governing body of the province of Alberta phased out the existing Seniors Advocate role, which was amalgamated into a Health Advocate role. Several calls from across the province did stress that that consolidated advocate role would mean a decreased ability to track and report on systemic issues affecting older adults. A seniors advocate, which did exist in Alberta pre-2019 and hopefully will exist again, would have three key roles, one being to help older adults navigate systems and access support, outreach to older adults groups, and to make recommendations to the government for improvements. While it is clear that the City of Calgary understands there's a growing population of older adults experiencing homelessness, for the best success on the local level, there must also be provincial level support to understand, track, and identify system level issues. So a step here would be for the City of Calgary to advocate for the reinstatement of a seniors advocate at the provincial level to oversee all actions led by the province of Alberta on issues related to older adults. And with that, I will pass to Tara.
Thank you, Isabel. The last city that we looked at is Montreal. Okay, so to provide some context, in Montreal, housing is considered relatively affordable. Additionally, Montreal has many programs and services in place that deliver social and community housing. This is through the OMHM, the SDHM, and housing cooperatives. However, despite the availability of services, supply does not meet demand. Currently, wait times for programs are extensive, with an average wait time spanning 2 to 6 years. It's also important to note that older adults make up the largest clientele of these social and community housing programs, as both their largest users and waitlisters. So, what does this mean? Between 2018 and 2022, Montreal saw a 33% increase in homelessness. In 2018, a point-in-time count identified 3,149 unhoused individuals in the city, and by 2022, that number had grown to 4,690. The 2018 and 2022 reports on homelessness provide insight into who was affected and why, and particularly highlights that the homeless population is aging. For example, 22% of respondents to age 50 and older reported losing housing for the first time between 2017 and 2018. And in the 2022 report, 43.3% of respondents were over the age of 50. Matching this trend, the average age of shelter residents, specifically in shelters provided by the Old Brewing Mission, is rising, with 1 in 4 shelter residents being over the age of 60. And just the next slide, please. So despite the high home ownership rates held by older adults in Montreal, housing unaffordability, especially for those without fixed incomes, long wait times for subsidized housing, and unadaptable housing options are driving the incidence of homelessness in older age. Currently, about 1 in 3 older adult renters in Montreal live below the low-income cutoff and spend more than 30% of their income on housing. The impact of this is clear in the growing number of older adults experiencing homelessness and the older average age of shelter residents. In fact, the second most cited reason for homelessness in Montreal, as per the 2018 report, was the inability to keep up with home payments. So based on the jurisdictional scan conducted, the following recommendations were developed to enable older adults experiencing homelessness in Montreal to age in the right place. The first is to reimagine the housing first approach to include first-time homelessness older adults. The second is to require all new missing middle housing developments to apply universal design guidelines. And the third is to expand funding and eligibility for home adaptations. Okay, so let's dive into the recommendations. The first recommendation is to reimagine the housing first approach. And to provide some context, currently there are a lot of shelters and housing options available to people experiencing homelessness in Montreal, like emergency and transitional shelters and temporary accommodations. But oftentimes, the eligibility requirements for these shelters largely overlook people who are experiencing homelessness for the first time, and this contributes to a lack of early homelessness prevention. That's where the Housing First model comes in, one with a very specific focus on older adults who are experiencing homelessness for the first time. Housing First is an evidence-based approach to ending and preventing homelessness, which was first rolled out and evaluated in Montreal between 2009 and 2013 under the project name CHEC. As part of the Housing First model, housing is provided to individuals experiencing homelessness with little to no requirements or preconditions, and then, once the individual is housed, additional supports are provided as needed. This approach actually proved to be highly feasible in Montreal, with the majority of participants housed in apartments of their choice within the first 3 months of recruitment. But despite the overall success, the top-down structure of the initial program design, which was designed at the federal level with limited flexibility for local adaptation, proved to be a barrier to its sustained implementation. As such, our scan indicates that the rollout of this model would be more effective if Montreal, if led by municipalities, and if local resources and expertise were fully integrated into the planning and implementation process. And actually, an example of the Housing First model being adapted to a local context can already be observed in Montreal through the Old Brewery Mission's Neighbors in the Community program. This program supports women experiencing homelessness by providing subsidized housing in the community quickly. And this program is sustainable because through municipal and provincial partnerships, residents are provided rent geared to income subsidies, and through partnerships with community organizations and healthcare practitioners, psychosocial supports are provided as needed. And ultimately, the call for an adapted Housing First model, one which prioritizes stable and affordable housing, is grounded in the understanding that early housing stability can prevent first-time homelessness from becoming chronic. The 3 recommendations for the implementation of this adapted model include the following. The first is to invest in homelessness prevention and intervention strategies, which follow the Housing First model to support older adults experiencing both first-time and chronic homelessness. The second is to enhance municipal, provincial, and organizational collaboration to scale up Housing First program delivery for older adults experiencing homelessness. And the third is to expand eligibility criteria for all shelters and transitional housing to include individuals who are experiencing first-time or even hidden homelessness. And the second recommendation made for Montreal is to include universal design policies for missing middle housing in particular. The province of Quebec has been at the forefront of age-friendly city design since 2012, and a key requirement of age-friendly design, as set out by the World Health Organization's Age-Friendly Cities Network, is the design of cities and infrastructure to enable people to age while maintaining their independence, autonomy, and quality of life. Universal design is one way to create adaptable and accessible infrastructure that enables people to age in place. In Quebec, universal design guidelines apply to new construction, but exemptions exist for buildings with fewer than 8 units and for those under 4 stories. This exemption primarily affects missing middle housing, which includes multiplexes, townhouses, and low-rise apartments. And this exception is especially significant in Montreal, where 78% of existing residences fall into this missing middle category. Missing middle housing is essential because it promotes diversity in the housing supply, and as a result of this, helps to keep home prices more affordable. But to ensure sustained affordability, it's essential that we design these spaces intentionally. Universally designed homes support people of all ages and abilities to age in place, reducing the risk of homelessness for older adults whose physical, mental, and social needs may change over time. When we see that many older adults experiencing homelessness for the first time in later life, despite Montreal's notably high rates of home ownership and stable rentership, we need to challenge why they're unable to remain in their homes. As Montreal pushes for more social and affordable homes, with an anticipated 763 units being built in the coming years, we call for this housing to be inclusively designed and forward-thinking to ensure that these homes are stable and adaptable across the life course. As part of this, we recommend removing exemptions in the provincial building code to ensure that universally designed guidelines are applied to the development of all new missing middle housing, mandating the adoption of age-friendly cities approaches in all new municipal housing plans and urban development projects, and incentivizing housing developers to utilize age-friendly cities approaches with lower development fees and approval requirements. And the final recommendation for the City of Montreal is to fund more home adaptations. While requiring new builds to include universal design is crucial to enabling long-term aging in the right place, much of Montreal's housing stock already exists, and the majority of it is unadaptable or inaccessible to shifting needs. In 2011, 46% of adults aged 65 plus in Montreal were homeowners, and 54% were renters. Older adults occupy a range of independent housing types, including duplexes or triplexes, single-family homes, low-cost housing units, and condos. But regardless of the type of home, as adults age, many have difficulty aging in place due to the cost of maintaining their homes and the inaccessibility of existing home features to emerging health and mobility challenges. This is especially true for older adult renters who, in comparison to older homeowners, are more likely to live in unstable financial and social circumstances and be at risk of homelessness. Currently, there is an immense shortage of affordable, universally designed housing in Montreal and the province of Quebec as a whole, with only 1% of social housing in Quebec designated for people with disabilities, and over 70,000 Quebecers waiting for housing suited to their needs. The lack of accessible housing affects not only older adults, but also the broader population. Since many older adults already own or rent their homes, ensuring easy access to home adaptation is a key homelessness prevention strategy, especially in Montreal, where older adults are experiencing various forms of homelessness for the first time in later life. It's important to note that the City of Montreal and the province of Quebec already offer some home adaptation supports through the Home Adaptation Program and the Reno Region Program. But both of these programs have extensive waitlists, and they also have exclusionary eligibility criteria. And the waitlists for these programs are further extended because tailored home adaptations require approval from occupational therapists who are often in high demand and difficult to access. And also, the SHQ released a statement in November 2024 announcing the temporary suspension of the home adaptation program, citing that despite the higher budget than previous years, that the demand just simply outweighs the supply. But we believe that continued investment in adaptation is critical because by promoting housing safety, stability, and affordability, these home adaptations play a critical role in preventing homelessness over the long term. And a great example of a community that is age-friendly and proactive is Sausalito, California. As part of their age-friendly Sausalito commitment, the community designed a low-barrier home adaptation grant that is available to anyone age 60 plus, and it's not limited to people with functional disabilities. And they also established a multi-sector neighborhood task force to review these adaptation requests so that the reliance on occupational therapists are reduced and the process is more streamlined. And based on the recommendation for expanding home adaptations, we recommend investing in long-term sustained funding for the home adaptation program, streamlining the approval process of home adaptation applications by enabling roles outside of occupational therapists like a trained community task force, housing providers, or healthcare practitioners, expanding the eligibility for the home adaptation program to include all adults aged 55 plus and not just those with functional disabilities, and creating a targeted home adaptation grant program for renters to minimize the reliance on landlords. And yeah, thank you so much everyone for listening and for being here. I will pass it on to Sarah for the Q&A moderation.
Thank you, Isabel. Thank you, Tara, for your presentations today and your work on this policy report. We now have some time for Q&A. So if anybody wants to use the chat or the Q&A function for any questions that you might have for our panelists. I will also put some links in the chat box here where you can access the full report. You can subscribe to our newsletter. Don't worry, we don't do too many new mail outs, only about 4 times a year, with all of the project related updates that we have, which are quite varied. This is just a small smidge of what we do. And then if you just want to follow up with any with myself or the project coordinator, Joe Humphreys, in general, our contact details are at the last link there. So there are not any questions at the moment, but I did see a comment, and Tara, this is for Montreal, and for Michelle, and where the comment was 763 homes in Montreal over a few years. That sounds like a really small number.
Yes, I was just responding to that through text, but yeah, this is just for very quick construction, and it's specific to social and affordable housing. They have a different strategy for the next 5 years with a big investment of $700 million for construction across Quebec.
Thanks, Tara. And thanks, Michelle, for the question. And Isabel, I think this one will be for you. It's in the Q&A, and asks, can you read it, or do you want me to read it, or what's best?
Whatever you'd prefer, but I can see it. So Michelle's question about the Calgary one-stop idea for info, the benefits of the city leading it, as opposed to community group being funded to do so. Yeah, that's a great question. I think initially the thought was that they already had set aside some funding and planning for that initiative. And so there was some structure that existed for that purpose. And in addition, I think the other part of that was hoping that community groups, housing providers elsewhere would be able to focus primarily on that function rather than having to also host information on other items and other things. So at least my idea was that the city of Calgary would be slightly better placed to do so, and able to speak across housing, medical needs, mental health, social support, all of those things, and leave the more focused function to the housing providers. I hope that answers your question, Michelle. Let me know if that doesn't.
Thanks, Isabel. And there is another one, Calgary specific. If you know this, and you might not, but did anything you come across speak to what happened to the modular homes that were closed in Calgary? Are they sitting empty? Were they broken down into parts? I know in Vancouver that this has happened in a couple cases. So I don't know.
Yeah, so unfortunately, I think this question actually might be about the Vancouver section, which I'm a little less of an expert on since that was Dominique's section, but can definitely take that question to her and get back to you if you want to provide an email. But maybe even Sarah knows a little bit more about that. But I'm pretty sure the modular homes you're speaking about there are related to Vancouver.
Yes. So right, related to Vancouver is they are sitting in warehouses empty, from my understanding. I don't have all the specific details, but we can dig that up and get back to you if you'd like, Nani, and you can send me a private message with your email and we can connect there. There was an earlier question about how the new Canada Builds program is going to affect low-income non-market housing. Isabel or Tara, did you come across that? Unfortunately, I don't have an answer to that myself.
No, it's a great question as well. And unfortunately, we didn't actually look into this while we were writing this report because it's more recent than our report to work. So that is something that would be really good to know how that will connect to provincial and municipal governments. But of course, that's a federal program. And the focus of this project was municipal, just from the focus of let's keep things local. Let's see how the existing systems can work with each other. But it is a really good question, and I would love to take a look at that as well personally. Tara, do you have anything to add there?
No, you answered that perfectly. Thank you.
Thanks, Isabel. Someone asked the question of, can you talk more about supportive housing models and whether these can be designed around age-specific needs? Or do they often incorporate many different generations with more complex needs, for example, mental health or substance use?
So I didn't specifically look into supportive housing models in the Montreal section, but one call for the Housing First, the Housing First model adaptation for older adults specifically would call for this supportive housing aspect to be considered when providing housing for older adults who are experiencing homelessness. And as part of this, it is about the accessibility of the unit itself, and how to work with healthcare practitioners and community-based organizations to provide these supports in community and in homes that are accessible to different needs.
Yeah, and just to add to that as well, I think the question about whether they incorporate generations with more complex needs, there are certainly places that do that already, and there's certain places that don't. So that is also an issue that we came across in our research, was that some places were supportive of substance use and figuring out pathways to help someone with that. So some were supportive of mental health, but some were abstinent-based, and some were not able to provide extra support. So that is there's a lot of diversity in how supportive housing models approach that. Just in Calgary, the Peter Coyle Place does provide, for instance, mental health and addiction support to residents, and also has a partnership to provide some on-site medical services. So there are some that are designed around those complex needs. Thank you for the question.
Thanks, Tara and Isabel. So we have one about home modifications or adaptions. So someone makes a comment. I'm curious about your recommendations to open up assessment for home modifications / adaptions to professions outside of occupational therapy. Is there evidence that this would support improving value for money in terms of government investments in home modification? It's my understanding that occupational therapists are specialists in assessing a person, their health, and the home environment. Home modifications can be expensive, so if not done properly, they can be both expensive and ineffective.
Yes, thank you for your question. This recommendation, specifically in Montreal, the home adaptation programs are really high in demand and are not meeting the demand specifically because of this need for occupational therapists. So our recommendation is that the process can be more streamlined if some of these smaller home modifications can be made proactively, so you don't need to have a functional disability. You could be an older adult, age 55 plus, who is thinking of modifying their home. And as part of this recommendation, we're saying that you do not need this consultation with an occupational therapist. And this frees up that space for folks who need the more expensive home modifications that are more tailored to their needs. And this was also based on the case study in Sausalito, where this task force is made up of different healthcare practitioners and policymakers who are able to look at the adaptation requests and determine if this needs to be sent over to an occupational therapist first, or if it can just be streamlined and approved through that task force. So we're not recommending to get rid of occupational therapists altogether, but just to streamline the process a bit more.
We did go ahead and post the URLs again in the chat box there for folks. Another question here is the depth of city-specific recommendations is really impactful. And I'll just make the comment too, is that we were focused on Vancouver, Montreal, and Calgary specifically, because that's what our original funding was for. But so back to the question, I'm curious what the next steps for this work might be. Are you hoping to connect with municipalities or local groups to advocate for the policies? Are you doing more research in other locales? Yes, this is sort of the first step in our knowledge mobilization efforts. Now that the report is done, get the word out that these recommendations are in place to work with municipalities or other groups that are, we had a great interaction already in the chat box with some work that's already ongoing in Vancouver around the transportation recommendations. So we'll follow up around that. But yeah, if there's ideas for connections that we can make with other folks, and how we can sort of roll out and share this policy report with folks, please let myself or Joe Humphreys know. At our contact details are on that one link. And then we have ongoing funding in the same 3 cities, but also we're looking at some new groups. And the broad project, again, is looking at promising practices for supporting older adults with experiences of homelessness in Vancouver, Calgary, and Montreal. And what are the shelter and housing supports and practices that we can call best practices for supporting folks in those locales. And so that's ongoing. And we have a whole host of research sort of outputs that would be sort of beyond probably the scope of this call for me to list, but happy to sort of connect with folks. We have a large amount of information on our website, and really just looking at, future best practices for supporting this group. I hope that kind of answers it, though it's quite vague, but there's just all this to say there's a lot going on. So I appreciate the question. What is your sense of readiness of municipalities and provinces to implement your recommendations? Great question. I'm interested in your thoughts on what it would take, how it could happen, and where the leadership would come from. That's a great question. I don't know, Isabel or Tara, if you have any thoughts on that. This is a relatively new field for me, so I welcome any sort of advice on this as well.
Sure. Yeah, it's a really good question. I think that something that was important for us when we were starting this work was to connect as much as we could with folks who were in the municipalities, whether they worked for the city itself or connected housing groups, housing providers, etc. So I think we tried really hard to come up with recommendations that were feasible and were creative and use stuff that already exists, but expands on it a little bit or takes it in a slightly new direction. So, I mean, in my opinion, I think they're feasible recommendations to implement. It certainly, the sense of readiness, it's hard for me to say as somebody who doesn't work at one of these municipalities, but I would hope that these recommendations are able to be taken in and, then discovered whether or not they are actually feasible from the internal perspective. The other hope also would be that the leadership would come from these municipalities, since we aimed there, and then also taking in funding and other programs from provincial and federal bodies, because of course nothing in Canada works in just one place. It's all connected. So unfortunately, it is quite a complex way to go about things. But yes, I'd hope that folks are ready to take some of these things on, and I think that there is the possibility of doing so. And we did connect with folks at all these places as well. Tara, anything to add from your perspective as well?
Yeah, for Montreal, I would say that when you're particularly looking at homelessness and older adults in Montreal, there's not much being done in this space as of yet. But Centrades, it is a big organization that's doing a lot of work around this space, and the last homelessness count in Quebec was done in 2022. So I'm anticipating that they'll be doing another count and a report, especially after seeing the big rise in homelessness between 2018 and 2022. So I would say that there is an interest in getting this work rolling, and Quebec and Montreal both have a big commitment to age-friendly frameworks and guidelines. So in terms of the recommendations for home adaptations and inclusively designed homes in the future, I would say that Montreal is positioned in a space where they could implement some of these strategies if we have some conversations and see what they think.
And I think too, hopefully by us doing this sort of, I'll call it like third-party research, it can really help inform the municipalities of, what we see, sort of from the outside is working really well, and where some recommendations for improvement can be made, and also borrowing from practices that we have found in other cities, and the promises that those other practices could be adapted to local context. So yes, we're ongoing in thinking about how we can reach out to those groups too. So hi, Rachel. Lots of work. Made a comment. Lots of work needed regarding buy-in in certain cities. NIMBYum is still a big challenge. Important next steps will involve meaningful grassroots efforts and actions like delegating at city halls to push councils to act. Also important to keep in mind that cities like Montreal have municipal elections coming up, a great time to mobilize. Thanks, Rachel. Any other questions? I see we're at the top of the hour. And to Vicky, I would love to talk further about studying in Winnipeg. We would need the right amount of resources to make that happen. We had, some limitations to our funding to the 3 cities that you saw here, but with the right number of resources, there's always efforts that we can try elsewhere. So if there are no further questions, I just want to take a moment again to thank CHEC team, Lindsay and Dr. Jim Dunn for hosting the webinar today. Thank you to Dominique and Isabel and Tara for all of the work you did with the research and connecting with folks. We will be posting a recording of the webinar along with the slides to our website in short order. And so keep a lookout for that. If you subscribe to our newsletter, you will definitely have that come through your email. So thank you all for joining us today, and I hope you have a wonderful rest of your day. Take care.
Thank you. Take care.
Thank you.